Hi, everybody. It's Dr. Mary Gardner, and I am hoping that you guys can see us live or see me live first. I am really excited for today's Facebook Live because I have my good friend and veterinary oncologist, Sue Ettinger, waiting in the wings. And Sue, I sent you the code, so I sent it via email. I wanted to do this Facebook Live for a number of reasons, because I know that a lot of families, when they hear the word cancer, they get all freaked out and scared. When they hear then the word oncologist, it even scares them more. And so I just wanted to invite my good friend on. She just popped off, and I know she'll pop back on again. My good friend, Sue, who's a veterinary oncologist, to kind of help dismiss some of these myths that might be out there. So I wanted to just start off also to tell you, hi everybody, some of my experiences. So I've had 3 dogs with cancer. My first dog was about 10 years ago. It was a Doberman named Neo, and he had an adrenal tumor, which I had it removed. And then unfortunately, it had spread to his liver. So we decided to do chemo with him. Now, the oncologist at that time, she said, without chemo, you have 7 weeks. And with chemo, you have 7 months. And I thought, you know what, Neo's doing so well that I want to give him 7 months. And we had 7 really good months with Neo. My second dog was my other Doberman with melanoma in his mouth. We had that removed and some vaccines. And with him, the first person I called was my friend, Dr. Sue, who's waiting in the wings. And so he did really well with that treatment. And now I currently have another dog. Her name is Sam. She's a 14-year-old Anatolian Shepherd. So this is a big breed dog. And she has lymphoma. So what happened was, a few months ago, she also has Cushing's, which is an internal medicine disease. So a few months ago, though, I noticed her dragging her feet and having a little bit of weakness in her hind end. But I knew she had great hips. Her spine looked great on x-rays. So I was wondering, what the heck could this be? Could it be degenerative myelopathy and everything else that's running around in my head? Well, I brought her to the neurologist, and we did an MRI, and we actually found that she has lymphoma in her spine. And so it is also happens to be in her spleen and liver. And so the first person I called again was Dr. Sue, just to kind of understand what are my options. And this is a 14-year-old dog. Like, that's very old to some people, especially with the larger breed. And what was the life expectancy that I could expect from Sam and with this disease, and what were my options? So I called Sue and got a consultation, and now have since gone to the oncologist. And today, Sam just received her 4th chemo treatment, and she is doing great. Even her mobility has improved, and so she's doing really well. And I asked Sue to come on to answer some of your guys' questions, and also, like I said, hopefully dismay some of the myths out there about oncologists. Now, I know a lot of you are like, I didn't even know there was such thing as a specialist in veterinary medicine. Well, there are a lot of specialists. I am just a wee general practitioner. But if I wanted to go on for 3 or 4 or 5 more years to do a specialty, there's cardiology. I'm back.
Oh, wait, there we go. Are you having storms? Are you having storms in Florida?
You know, we always have storms, but not today. This is just because the video gods want to just stop us, but we will not be stopped. And I am.
Well, my boys have strict rules. They are not allowed to be on Netflix or Fortnite right now. So
exactly. So I know I am hardwired in. I want this message to go out, and anytime I freeze, I will certainly refresh. And luckily, all of the people who follow us are awesome and are usually patient. So thank you for coming on, Sue.
Thank you. You know I love being with you.
I know. We get to travel so much and speak around the world, and we are grounded. So what better way than just to connect via video? And so Dr. Sue was the one who I call whenever I find a lump, a bump, a spot, or basically anything that scares me with the big C word, with cancer. So thanks for being there for everybody. And like I said, Sam did great on her chemo number 4 today. And
she had been Christine?
She had been Christine, yes. And she also gets some French fries afterwards, and maybe 2 for her, 1 for me. And so, Sue, I know that the biggest question that people ask is like, what about all the side effects? And in humans, we have all these bad side effects. Is it the same for pets in general?
Yeah. And I mean, so most of us unfortunately have some experience, whether it is a family member or a friend with cancer, right? Or we know somebody, in famous who has died of cancer, and then we don't even know what cancer it was. So there's so many different diseases. And, in people, cancer, when you get chemotherapy, there's a ton of side effects. And I always tell clients, chemotherapy in people is not chemotherapy in pets, and that is a good thing. So 80% of dogs and cats don't have side effects. So their quality of life on chemotherapy is often as good as their quality of life off chemotherapy. Most days are really, really good. It doesn't mean they won't have no side effects at all, but usually they're mild and what we say self-limiting. So they'll get over it on their own within a couple of days. But what I love about today's medications is we have really good nausea medication. So, I told you, and luckily your oncologist is really like me, like make sure Sam goes home with Serenia, an anti-vomiting medication. And we're very proactive. Go home with diarrhea medications because when to Murphy's Law, when is vomiting going to happen? 9:00 at night on a weekend, right? So you want to have them on hand, right? Yeah. So if they do happen, you can jump on them really early to make your dog start feeling better. And you can start treating them. But the good news is most dogs have very minimal side effects. And the other thing, Mary, and I told you this, and I tell, because when your own pets we're vets, right? But when our own pets have cancer or they're sick with any disease, we become as frantic as every other pet owner. Is if you're not sure about chemo, is give her a dose or 2 and see how well they do. And most people, they come back because they're like, oh, that's not as bad as I thought it was going to be.
Yeah. And I think that's it. We get so scared with what we see in human medicine. And honestly, for my first dog that went through chemo, Neo, I thought, I know eventually the cancer is going to kill him, not the chemo. And I hate to be so blunt about it, but I was like, that's how he will die, not because of his chemo. And what we were able to do was just slow it down. And 7 months, I'm so grateful that I did that. So now I know that the big.
And I really want to add to that, Mary, because that is such a great point. So many people say, I don't want my pet to suffer from chemo. And especially for a cancer like lymphoma, because that is a really rapidly progressive cancer that will cause symptoms. Pets get sick from that cancer. And I say, I understand that, but a little under half of those pets come in with some symptoms, and usually they're tired, they're not eating well, maybe they're vomiting or they're having diarrhea. And I say, I understand you don't want your pet to have symptoms from treatment, but they're sick from their cancer. So they're often, and I hate the word suffering, and I know you do too, but they're feeling unwell from their cancer. And the thing with lymphoma is 80 to 90% plus will go into remission on the CHOP chemotherapy protocol like Sam is getting. It's a high remission rate. But, just to kind of put the 30-foot perspective, every cancer is different. So if your pet has a different cancer, whether it's a dog or cat, it's great to consult with a veterinarian, ideally a cancer specialist, or have your vet consult with a cancer specialist. Yeah. So because every cancer is different. And the other thing I just want to put in there for the cat owners out there is, when I sit in the room, the cat owners, I go, of dog, cats, and people, who do you think tolerates chemo the best?
It's the cats, right?
Right. But who would think these little fragile creatures, but they have the least side effects of all of us. Yeah. It's amazing. So
it's amazing. And I've seen really good, especially with lymphoma with cats, like they do really well. Do they respond better? Like, is their percentage better?
The hard part with cats is gastrointestinal lymphoma is the most common form, which is only 5 to 7% of the lymphomas that we see in dogs. So cats that present with lymphoma, they're sick. I told you more than half the dogs that come in with lymphoma, they're feeling great. Like, they're still eating. They just have these big lymph nodes usually. Sam's unusual because his is it's in her spinal cord. But most dogs feel really happy. They're usually asymptomatic. They don't have any symptoms when they're coming in. Cats usually have it in their gastrointestinal tract. So they're vomiting, diarrhea, and or losing weight. So they're usually sick from their lymphoma. So they need their treatment to start feeling better. So going back to the owner says, oh, I don't want them to feel unwell. I'm like, they're already not feeling well from their cancer. So it's a little bit different. So they need that chemo to stop vomiting, stop the diarrhea, and start gaining weight and eating, which is interesting, right? You're going to give them chemo to treat their cancer to make them start eating again.
Right. And now, Sue, there are injectable chemotherapies, oral, what's the difference?
Right. And you don't get to pick, right? You don't go in and say, I'd like the oral chemo, please. It's like some drugs come in oral. Like, it would be great, ideally, if we could give every chemo oral, but it has to survive the stomach, and the stomach's a very acidic place. So most chemo drugs in general are injectable. And so, but a few do come in the oral form. So you can't go in and say, hey, can I just get the oral? So it's based on what drug works best for each individual cancer. But there are some that are oral and some that are injectable. Yeah. The other thing is, a lot of people, there's so much mystery, how does my pet get chemo? So, that was sort of a lot of the reasons that I made those YouTube videos. Oh, yeah. And so you can go to my YouTube channel just to see what it's like, because, most of us envision people in a chair, right? Plugged up to an IV. So if you go to my videos, you can see that, big dogs we do on the floor because they're happier on the floor. It's more fear-free. So we do them on a blanket. And, small dogs and cats, we usually will do up on a treatment table, and they're held during their treatment by an assistant, and then the chemotherapy nurse will administer their treatment. They're awake. It's very rare for them to be sedated. Most treatments are done over a couple of minutes. The longer ones usually take 20 to 30 minutes. So they come in, they get some blood work, they get their treatment, they get treats throughout the door. So, Sam's usually an hour to an hour and a half?
Oh, max. It's so easy. And now, to be honest, with curbside, care, I just call, they come get her. I just sit in the car, I go get her French fries, come back, and it's not that bad. And they do check her blood work every time for her. So is that something that is normal that you guys do also?
Yeah. So we have to check their white blood cell count to make sure that they have enough white blood cells, the neutrophils, to give their chemo. And then different drugs, we may have to check some other values like kidney values or platelets and things like that. So, we're always monitoring. And again, for each case, we'll go over the specifics. Some drugs, we have to check liver values and things like that. So there are certain things that we'll be checking for you. And again, certain drugs that we may not be able to give to a pet because they have pre-existing conditions. So again, that's why, it's hard to always give general recommendations, and that's why we can do these general things. But then if your pet has cancer, it's really important that you go and see a specialist, or again, have your veterinarian consult with a specialist as well.
Now, there was something that was really important that you told me with Sam. So she was, diagnosed, and Sam is a little bit of a unique situation with it being in her spine, which is not a normal thing. I just saw her not walking well, and I just went crazy. And by the way, she has since been walking, like I said, so much better now. So we're going to do another MRI in about 6 weeks to see if it's reduced a little bit. But some veterinarians may say, okay, well, let's just start them on steroids, on Pred. And if they do better, then maybe you go see the oncologist to see if there's something. So where I'm trying to get with, should we try Pred? What's steroids, and why should we maybe see an oncologist first?
Yeah. So lymphoma, steroids are used for lots of things in veterinary medicine. They're an anti-inflammatory and they're good, but for lymphoma, and this is one of the things, and that's, it's really important to know. And often people find out too late and they're frustrated. So for lymphoma, steroids are part of the treatment. once they start their chemotherapy. But if you start steroids before chemotherapy, it makes the chemo less effective. And so that was a very important reason why I didn't want Sam to start steroids, which is often used for neurologic disease.
Yep.
But if we had her on it and then she had a positive response, like, oh, it's treating her lymphoma, and then you started chemotherapy, it can decrease the effectiveness of the chemotherapy. So often I'll see dogs that had big lymph nodes, and then unfortunately they were started on steroids, and then they come to see me and, we start chemo. With that said, it's not a guarantee that chemo is going to be less effective. I have had dogs that have been on steroids. We've done chemo and they've beat the statistics. And then I've had dogs that haven't been on steroids and don't do as well. So it doesn't mean that chemo is not worth trying. But when you're fighting cancer, you want to put everything, in your favor that you possibly can. And you don't want to knowingly do anything that may be detrimental to a pet.
Yeah. Now, what's this whole staging thing?
There's so many, I shouldn't say stupid, but there are so many doctor words, that can be off-putting when you are a pet owner, because they're like learning a whole new language. Yeah. And, my dogs have a lot of internal medicine issues. And when my husband's an internist and sometimes he talks to me, I'm like, I don't know what you're saying. Like, please talk to me in layman's terms. So staging is a fancy doctor word for doing testing to figure out how far the cancer is advanced, or how far it has spread. So for many cancers, and let's talk about a different cancer, just for, so we're not only talking about lymphoma, but say a dog has mammary cancer, breast cancer, we would be doing staging tests like chest x-rays and or an ultrasound to see if it's metastasized or spread internally. We might aspirate a lymph node to see if it's spread to a lymph node. So staging tests are, again, just those diagnostics that your vet is going to do or the specialist is going to do to see if the cancer has spread beyond the primary location. And so for any cancer that has a chance of spreading, I say that there's two battlefronts. There's the battlefront where the cancer is growing, like in the breast tissue or bone cancer, osteosarcoma in the bone. And then the second battlefront is, has the cancer spread? And then if it hasn't spread, if it has a high chance of spreading, are we going to give chemo to prevent it from spreading?
And that's, I think, with my Neo, right? So I had it removed and we had a good chance for it to be benign, but it wasn't. And so then we did the chemo just to help with the spread. Now, do you have a case?
But we should point out, not every cancer, like there are low-grade mast cell tumors that you surgically remove because we find them early, lumps and bumps, do your monthly lump and bump check. So yesterday was the first of the month. I recommend everybody do a lump and bump check from their dog's nose and their cat's, from their nose to their tail, looking for those lumps and bumps, right? Because there are a lot of skin tumors and other tumors that if you find them early, they have a low chance of spreading and they don't need chemo. So I don't want people to think every cancer needs chemo, even some malignant ones. You could, low-grade soft tissue sarcomas, you do a nice big surgery because we find them early. They don't necessarily need chemo. They just need staging tests and monitoring. So not everybody needs chemo. I love to see cases and say, hey, we're just going to monitor. And, not everybody gets chemo. Seeing an oncologist doesn't mean you need chemo. It just means you're going to get an overview of your pet's cancer.
Now, that's what I like. So with me, and that's why I called you, I was like, well, what's my statistics? What are my options? And so now, Sue, I know that I've got your Facebook and Instagram up here, Dr. Sue Cancer Vet. Now, do you do consults to pet owners or to to general practitioners like me?
So that's a great question, because my email box and I get a lot of requests and it's really, really hard. So I, especially because I do a lot of videos and things like that, I don't give advice to specific pet owners on their pets because I can't do a good job because I haven't examined the pet and reviewed the medical records. But I do consults, teleconsulting, virtual consulting through FidoVet, which we're putting that up, which is for me to do consults to practitioners where I get to upload the medical records and then I could make advice to the general practitioner. In some cases, I may recommend that they go see an oncologist, but in some parts of the country, it may be 6 hours, 8 hours. But I do consultation. So for pet owners that may be watching this that say, I would love to have a consult with an oncologist. We also have internal medicine and adding other specialties as well. But, you say, I'd really love a consultation with Dr. Sue or another oncologist. You can ask your veterinarian to do the consultation through FIDOvet.com.
And if it's treatment that they could do themselves, then you can help guide them to do it and probably just provide a lot of good information.
Yeah. I mean, the problem with is that there's 450 oncologists in the entire United States and Canada. That's it.
Oh, and Canada.
And Canada. Yeah, that includes Canada. And that a lot of us are clustered in the major metro areas. So there's probably 20 of us in, the New York area where I am, and probably 25 in, the LA, Orange County, San Diego area. So there are parts of the country that I call the desert where there aren't people for hours. And so, I really love to help people, but what I think is really important is that as I was saying, I want to be able to make those specific recommendations. And I think that means, looking through the medical records, and I love helping veterinarians. So that's why I helped co-found FIDOvet.
Yeah, that's awesome. Now, I think somebody traveled 6 hours to see you yesterday with the mast cell, and I'm on a different Facebook group, and she's like, I'm going to see Dr. Sue.
And what I love about this is this woman was wonderful. So I haven't posted the picture yet, but she said I could. I got a media release. So Otis, beautiful. Otis. Yellow Labrador, like 85-pound Labrador. And I love a good Labrador, and I love to take a selfie with a good lab. And he was just beautiful. But she has an oncologist in Maine. She wanted a second opinion, and she drove down. She just wanted me to go meet her dog, see the tumor, see her dog, go through the medical records, make recommendations. She had seen my videos on mast cell tumor. She's already watched everything, but it was just perfect. And we wrote everything up. I know her oncologist. We actually did our residency at the same place. And I made some recommendations, a little bit different, but very similar. But she just had that confidence to know that, like a second opinion, even when they're pretty similar and agree, is great. It just lets her know that, we're on the right track and things like that. It was a recurrent mast cell tumor that came back sooner than it should have. But, tumors mast cell tumors are a tricky tumor.
Yeah, I remember those in general practice. They could definitely be tricky. And what's nice is, it is getting different options, and we all cook a little differently. We all treat a little differently, and not that one way is wrong. And what's nice is if Otis may, have some reason why that there's a change to be made, and then they could, maybe use a different protocol or a different approach. But for 6 hours, I would drive 6 hours to see you, Sue, but
I'm always honored when people make the trek to see me. I always hope it's a lot of pressure. I'm like, I hope I was worth the journey, but it really, really is.
No, you are definitely worth the journey for sure. And what's really nice is that because 450 in the United States, that's not enough. And so to be able to offer that through FIDO is really great that people can just at least get the knowledge. So maybe if 6 hours was her closest oncologist, just to get information before she even decided to do that might be really good. So that's awesome. Now, so I was thinking about this before and I forgot to ask, have you ever had a patient where there's cancer in the lungs and you've done chemo and because everybody worries, like once it's in the lungs, that's not good.
Have I ever had cancer in the lungs and a patient do well?
Yes.
Oh my God. Yes. I just, no, and I shouldn't respond that way, but yes. And I think it is such an important question that you ask, because when I was trained, when I did my residency, we put up those x-rays, and I'm old, so I'm talking about hanging up x-rays, not the digital, I'm talking about putting them up on the x-ray viewer, and a dog had, really bad x-rays. And so I have a series of vlogs where I show some of these, and it looks like there's snowballs, throughout the lungs. We would tell an owner 1 to 2 months, and we know traditional injectable chemo that we're giving Sam, or that we would give a dog with osteosarcoma before the cancer is spread to the lungs, typically doesn't work. Now there are some oral chemotherapy protocols, some metronomic protocols that have been successful. And I have had some dogs live 6 months to 1 year to 2 and 3 years. And one dog lived 4+ years with metastatic thyroid cancer. In that video, I show Oprah, who had we think it was metastatic mammary cancer, and she lived almost 3 years on these protocols. I just did an IGTV video about Joey, this beautiful Maine Coon kitty that has metastatic pancreatic adenocarcinoma, super rare. He's on this Palladia protocol, and his tumors have shrunk 50% after being on this protocol for 7 months. Wow. And I'm also treating him for IBD. So the point is, there are definitely options for dogs with metastatic cancer. It doesn't work in every patient, but it does work in a subset of patients. And for the right owners that are willing to give pills to their dogs every day, but I'm continuously no, many owners are, but you have to be able, if you can't pill your dog or cat, I couldn't pill Peter. It was not, when he had IBD, like pilling him was complicated, but many owners, they got this, they really do it, and it can work. And I think it's a really important question. And, to be honest, Mary, that's why I do these vlogs, is because I want people to know that there are options. And then if they want more information, they can, follow up with a specialist and things like that. But there are options for dogs with metastatic cancer. And to me, I almost get emotional about it, because to know that there are dogs that are still alive after that, compared to what I was taught. And it's not that what I was taught wrong in my residency is these options didn't really exist. Right. Oprah's mom contacted me. I laugh because it's Oprah's mom, but Oprah's this big Dobie. And her, I treated her probably 5-7 years ago. Another one of her dogs just had a lung mass removed at a different hospital up in the upstate New York area. And she was like, "Do you remember me?" I was like, "Do I remember you?" Oprah's in my lectures, So I think it's a really important, lesson for us to remember that there are options. And that's why I just want people to learn about their options. And if you decide not to treat, that is okay. Right. I get it. But what frustrates me are the people who find me 2 months, 6 months later and say, "I wish I knew about you. I would have treated, but no one told me that there were options for my pet." And that's heartbreaking.
Yes. Yes. And I find that also with doing end of life care with Lap of Love is that it's not heartbreaking helping it's sad helping families, say goodbye. It's sad because they're losing a loved one, right? But what's heartbreaking is oh my gosh, if they had only known, if they had seen, and not even if a year before that they went and saw something that we could have gotten more time, but we might have gotten better time. Right. And that's with, and better quality of life. And so that's what makes me sad too. So that's why it's better to get your information sooner so that you can make your options better, to what's best for your family. Right. Versus I'd hate to be you to be like, well, if you saw me three months ago, I could have done more.
And I get videos from clients, and you may not be able to send me. Sam was never a dog who was running on the beach, because you told me she was always kind of slow, right? But I get videos from clients that are like, their dogs are running on the beach in the middle of chemotherapy, right. And their dogs are doing agility in the middle of chemotherapy, like their quality of life. And then there are dogs like their quality of life is sitting on the couch with you, because that is what they do. But where they go on their 1 mile walks. I have this one dog that I'm treating right now that was Copper. He has 2 chemo treatments left in his CHOP chemotherapy. He goes on 5.5 mile walks every day.
Every day.
Not 5, 6, 5.5. But that is his quality of life, for going on his walks. And he gets to do that while he's on chemo. Some days he's a little tired, but most days he gets to do what he wants to do. And it's awesome.
Yeah. I love it. So now, Sue, if you weren't a cancer vet, what would you, and you can't even pick a vet. You can't say that you'd be another, what would you like to be? This is the little Dr. Sue.
You didn't warn me about this.
I know. I'm going to throw it out there. Everybody like thinks that, being a vet is awesome, but something different. If you couldn't be a veterinary oncologist.
Well, back in undergrad, I loved art history. But I thought I would major in that, but I don't know how you make a living doing that, right? I don't know. I always thought, when vet days are bad, the surgeon and I in our other practice, we always talked about maybe owning a florist shop because we would get to surround ourselves with flowers. And most of the time, except for funerals, when you're delivering flowers, it's usually like happy moments, right? You're celebrating anniversaries and birthdays and things like that. So you get to surround yourself with beautiful flowers and it smells so nice. So maybe I would own a florist shop. I don't know. I have no idea if it's profitable. No. But I love flowers.
I love it. Speaking of like your good news, I love following you on your Instagram and Facebook. But what's great is when you have graduation certificates. Mm-hmm. For those that have made it through chemo. I love that. It's so much fun. And I think it's nice for owners to have that, that badge of success, if you will. And
so the practice that I'm at now, so my one of my oncology technicians also happens to be the hospital manager, and he is really into this. So he actually buys a basket or a little soft crate, and he puts stuffed animals into it and little chew toys and sometimes, hats from the hospital and stuff like that. But he goes all in for this and stuff like that. And I do think it's a really important celebration. The interesting part, Mary, and you'll have to check back in with us and let us know, is a lot of owners, what I find is they get really nervous on that day because you have the reassurance that you're coming in and you're seeing me weekly, or every other week or every third week, depending on the protocol. And then all of a sudden you're graduating and I'm like, okay, come back in a month. And you're like, a month? And I'm down doing my dance. I'm like, graduation. They're like, can I come back next week? I'm like, no, So, but it is still really a great day. And they're also happy not to come back next week and pay a bill. So.
That is true. Now I just see one person here is Shelly. My 13-year-old dog was given 3 to 9 months to live in April of last year. She still has him, thankfully. He has an inoperable tumor on the sheath of a nerve in the brain stem, and it's resting on his brain stem. They said chemo wouldn't help much, but could be an option. I wish I had seen this sooner. His legs are failing him, and his head is sunken in, but he still is so happy. Well, that's because also he's you didn't say a breed. I was going to say a lab because I was thinking about labs. They're always happy, but maybe the options would give him. So she wishes she saw this sooner. But listen, Shelly, you're taking such good care of him for over a year. And that's what, these statistics are just that. They're just the average. And sometimes we have less and sometimes we're blessed with more. I was given for Sam about a year. So let's, and she's 14. That's the other thing is a lot of people say oh, it's a 14-year-old. Why do that on such an old dog? And that, is one of my soapboxes. Other than this, she was fine.
And Mary, I want to point out, because we have the quality of life scales, and I want to point out and the most recent comment from Jennifer talks about how helpful those quality of life scales are. I think they are super important because I struggled with Jeter, my kitty, with IBD that became lymphoma, with quality of life and how hard it is, and I think quality of life is this term that we often throw around in veterinary medicine as veterinarians. And then we talk to it with pet owners. And I do think it is really hard to figure out what, I'm getting emotional because I'm talking about Jeter, but what quality of life is. And the quality of life scales that you guys have are amazing. So if anyone's watching, even if you don't need them now, make a mental note of bookmark them or remember that they're there, because they are a great resource. And it's hard to tell. I mean, I'm married to a vet and we still struggled, with
it's super hard. And I think even doing the scales now before it gets, I don't want to say bad, because then you can kind of grade what they are now, take pictures now, because as Shelly said, the head sinks in, you might see some changes of what the normal was. And Shelly says she's a large breed mixed dog. I gotta tell you, the best thing ever with hind end weakness is my Help 'em Up harness, which I can't say enough about that harness. And that's really helpful for my girl Sam, and just to pop her into the car is so much better. So Shelly, just definitely try getting some help if you need it. Now, Sue, you know I could talk to you all day, and I miss you terribly being on the road.
Too.
And I'm going to put up your little doodad here to make sure people know how to follow you, because you are awesome.
Mary, smile.
Okay. And, you know, Sue, I'd love to say that you have the best clients, but at Lap of Love, we have the best clients. So, and families, we both have the best families that just love their pets unconditionally as much as their pets love them. And I appreciate your time. And thank you, everybody, for dealing with a little bit of techo problems in the beginning. This was my first shared screen. So, oh my goodness, I see Janet has a good question. Is it true? Last question. Is it true that cats mask their symptoms when they have cancer? For yearly well visits, should you all do an ultrasound and blood work?
I think cats and dogs can both sometimes, mask their symptoms, but I'm going to go and say that twice a year. I really think for dogs and cats, when they get to middle age, they should have blood work with urine. Because you want that urine to help evaluate the kidneys, and an ultrasound. I'll say chest x-rays as well. But the reason I say twice a year is just think about how pets age, and that, we say that 5 to 7 years for every year, so really twice a year. And also make sure you're tracking their weight, because weight loss is so hard to tell in our fluffy pets, and weight loss can be a sign of disease, not just cancer, but GI disease and other kidney disease and things like that. So yeah, definitely get them weighed. Your vet's exam is going to be so important as well. Blood and urine, ultrasound, and chest x-rays. And that's not just going to pick up cancer, but other diseases as well. And early prevention and detection is going to be so important, not just for cancer, but other diseases as well.
So true. Awesome. Well, like I said, I could talk to you forever, and maybe we'll steal you again one day in the future.
Thank you for having me.
Yeah, so they can find you at Dr. Sue Cancer Vet, as I see there. And then again, you do consultations to veterinarians through fidovet.com. So if a pet parent wants to get some information from you, or for you to look at their kid, it has to go through their doctor.
Yeah, and literally a ton of advice, or not a ton of advice, but a ton of information on all the major cancers in dogs and cats on my YouTube channel. And the monthly lump and check video is vlog number 73 on YouTube. And guys, first of the month, do your lump and bump check.
Lump and bump check.
Find anything, see something, do something, why wait, aspirate, go to the vet.
Yes. And look at, I even got my little calipers, which is Dr. Sue caliper. It's to measure those bumps.
I love you.
So, I love you too, Sue. And we love all of our Lap of Love families. Thank you guys for tuning in. And until next time, love up on your gray muscles for me. Bye.
Have a good one.